a patient enters the burn unit, every nerve is raw and exposed. So even a slight breeze from a nurse walking past creates this excruciating pain. Yet no one would ever consider telling a burn patient that they were being oversensitive. Couples dealing with infertility often emotionally resemble burn patients. A darling picture, an innocent question or comment will elicit this painful response that is confusing and frustrating to friends and family, who then decide the couple is being oversensitive. My son and daughter-in-law are among the population that has been described as the most neglected and silent minority in the U.S. My daughter-in-law is one of 7.3 million women who sought infertility services between 2011 and 15. 7.3 million. That is the combined total population of Missouri and Maine. It would be easy then to just see them as a nameless, faceless person in a crowd. But these people are not faceless or nameless, and they are not a statistic. These are my kids. And they are dealing with a heart-wrenching trial called infertility. There are three things I want to bring out about infertility. First, that it is more than just a medical condition. Second, that it can be a stressor on a relationship. And third, that there is hope and help available. Infertility has a psychological component. For women, the prevalence of depression in women with infertility issues is twice as high as those without. Their depression and anxiety scores are as high as someone with HIV positive, recent heart attack, or cancer. For men, studies have shown that the symptoms of low self-esteem and high anxiety persist up to 18 months after the medical treatment has ended, regardless of whether or not a live birth was achieved. So this shows it is also a psychological issue. My daughter-in-law, after one of her miscarriages, wrote the following: I feel like I have just been sitting in silent observance of this deep tragedy in my life. All is not lost, but some days I feel like I am. Motherhood has always seemed like a tether to the unknowable heavens to me, something that connects you directly to God, a conduit of divine power and meaning, and I am cut off from that through circumstance and pain, and that hurts in a way that words could never express. I think she poignantly shows that this is not simply a medical condition, but affects other areas as well. The social aspect of a couple's life gets impacted when the couple starts avoiding anywhere with children. So they pull back from family, from church, from parks, and cutting off potential support networks in order to avoid having children. So we have a psychological and a social aspect. The marriage relationship becomes imbalanced when the unborn child comes between the couple. The baby's needs, the fertility treatment, supersede life and needs of either person. Also, the husband often feels the need to be strong for his wife, and so in order to do that, has to pull back emotionally. Spontaneity in sex is lost, and that cuts off connection. Finally, the cost is exorbitant of fertility treatment. So obviously, these are all huge stressors for the marriage relationship. However, there is help available. This trial is difficult, but it also has the potential to create a strengthened relationship. If we can treat the psycho and the social aspects along with the medical component, then we can make this a stronger relationship and individuals. There are two modalities of the many that are effective. One is cognitive behavioral therapy that provides relaxation techniques, stress management, and coping skills. Emotion-focused therapy strengthens the relationship and provides decreasing anxiety and has been shown to lower depression more effectively than medication. So now we can see that this is more than medical. There's psychosocial involved. It is a strain on the relationship, and there is hope and healing available. If you are struggling with this trial, I cannot give you a baby, although I really wish I could. But I can give you the assurance of the possibility of finding a sense of well-being, connection, resiliency and growth despite this trial. I would tell you that you are not alone. And I would ask you to search for the support groups in your area or online. And I would beg you to call a therapist. Please don't try to navigate this path alone. These resources can provide the insulation around your raw emotional nerve endings and allow you to find healing and connection in your relationship. While this trial has the capacity to define you, you can allow it to refine you. And I would challenge you to allow infertility to refine you rather than define you. Thank you.